On the second page of your study map, you'll find an area titled Possible Areas for Testing on the NCLEX-RN. As I made these maps, I was simultaneously creating questions for a practice exam bank. And so every time I created a question, I put down the content area on the back of the map to keep track. And what I found after moving through quite a number of these questions were some common themes that were coming between the different types of illnesses in a systems area. So for example, in this case, respiratory. So these statements or questions are really meant to help increase your critical thinking level. So for example, the first statement is determine the types of clients at risk for ARDS. So that helps you move kind of between the predetermining factors. Also to outline the pathophysiology in each of the three phases, and to outline assessment findings linked to respiratory failure. So what you'll start to see in the different maps in respiratory, for example, is that you do have to recognize clinical decline and respiratory failure. And that becomes a common theme as you move through all of the different disease conditions. In the case of ARDS, I thought about areas that might be specific to that condition. And in this case, it's a calculation of a PF ratio. And a PF ratio is when you look at partial oxygen in an arterial blood gas, and you divide it by the FiO2, or the oxygen flow rate, which is typically 0.3 or 0.4. We know that it can go up as high as 1, which would be a patient who is on 100% oxygen. And so what they do clinically is you divide what the patient has really in terms of oxygenation at a base level in the arterial bloodstream by what they require for oxygen, and it gives you a ratio. And I believe if it's over 200, or around 200 rather, it tells you they're at risk for decline in ARDS. They'll ask you questions, why would a PaO2 level be kept at least 60 in this condition, right? And so what you're doing is you're moving through those critical thinking sides. So these questions, they're not answers to them. And, I thought about putting the answers in, but really the key part with these maps is that you have to start figuring out these higher level concepts on your own. Because as you figure them out, you're going to find a way to retain them. And by all means, if you get stuck on one of the questions or statements in the possible areas for testing on the NCLEX, you can just give me an email at marnie@rnstudyguides.ca. You'll also find a little section that says make your own case study. So if you're having trouble remembering some of these concepts, think about making a case study and highlighting the information or content that you're having difficulty retaining. And then lastly, you will find the references and any links to any of the YouTube videos on this site as well. So these pre-made study maps, they give you a head start. They direct you in terms of areas of content that you need to be confident in. And they also help you to think about things at a higher level. I wish you all the best as you move through the study map portion of this program.